So it seems that not only can we make a cosmetic benefit to patients by having their facial structures and bones balanced correctly, there's also lots of examples of how various medical conditions can be improved by having the jaw in the correct position and this kind of thing. I'm sure you've got plenty of examples of how some of your patients have almost seemingly miraculously been cured from various health issues. Are you able to share any of those with us without breaching confidentiality, of course?
Oh, for sure. Now that I've been practicing this type of functional orthopedics for many years, I get a lot of word of mouth referrals. And I can distinctly remember about 10 years ago, a fairly distraught mother brought her child to me. The child was in year 6, about to undertake some fairly major exams to determine which high school she would end up with. And the mum said to me, look, in early years, my daughter was highly intelligent, was ahead of her reading class, was coming first or second in the class, and lately she's down the bottom of the class. The medical practitioner that we saw diagnosed her as having attention deficit disorder because she wasn't paying attention in class, etc., and prescribed a drug called Ritalin. And I said, look, has anyone checked this child's airway or how they sleep at night and the size of their jaw? And she said, no, I didn't think the two were related. When I first looked at the child, I could see she had classical symptoms associated with sleep disordered breathing. She had that venous pooling under the eye, she had the cracked, dried lips, she had the mouth breather gingivitis, sort of this posture.
Yeah.
I sent it to my colleague, who was an ear, nose and throat doctor. He realised that she had large adenoids and tonsils and subsequently had those removed. I looked at the palate and realised it was tiny like that. We widened the palate using an expansion appliance, which certainly helped her breathing. Her dark circles of the eyes disappeared and she was sleeping better. But the real proof of the pudding is that the mum reported to me 6-7 months after our early treatment that she was off her Ritalin, doing well at school and back to the top of the class. And I think that's the most rewarding thing anyone can do in general dentistry or orthodontics. I don't think anyone, patient-wise, ever thanks you for doing a root canal on the upper right first molar. But when you get patients who write letters, and that particular patient, I remember because she wrote a letter to me a few years ago saying, Dr. Mahoney, you may not remember me, but you did this early treatment, etc., etc. I'm now pleased to tell you that I got enough marks to get into medical school. And
wow.
That's just fantastic. I obviously wrote back to her and said, well, you make sure that when you do medical school, you have a bit more of an open mind and not just treat in the traditional approach of maybe diagnosing and prescribing drugs or medication when there are other underlying issues. Also, I think what we do in functional orthopedics helps the position of the jaw. I have a lot of people who have chronic headaches and they don't seem to know why. I'd recommend to every patient to buy a book that was published about 5 years ago by a dentist in the United States, Dr. David Page. And the book is just simply entitled Your Jaws, Your Life. And in that book, David talks about a number of ailments which the medical profession doesn't really relate to the size or position of the jaws, and yet there's clear studies and a lot of the scientific literature that link the two, such as Meniere's disease, such as...
So Meniere's disease being sort of tinnitus, ringing in the ears,
correct,
like a thumping, like a pulsing in the ears, that kind of thing, and migraines that are that kind of thing.
And we've also found that could be related to the lower jaw being pushed too far back and pressure on the TMJ.
So the trauma from the jaw joint causing the pain and the problems in the inner ear, basically.
Exactly, or exacerbating that fluid build-up in the middle ear. We also see a lot of patients who are told to take their dentures out at night when they go to sleep. Taking the dentures out often causes the jaws to collapse, the lower jaw drops back due to gravity, more chance of snoring, sleep apnea concerns. So I think the big three when it comes to medical improvements with functional jaw orthopedics is better nasal breathing and hence a better sleep cycle, less incidence of TMJ problem because the lower jaw's in the correct position, and related to that, less chance of snoring, sleep apnea as we get older.
Sure.